Core Physio and Pilates video series. I'm Lee and this is Liz. And today we're going to be doing a series of exercises for lower back pain, which as you know is too common. So these exercises will be teaching you how to mobilize and get flexibility back through the lower back, which is often a very big cause of back pain, stiffness, and strengthening as well. So the first exercise is known as spine twist. I'll get Liz to lie on her back or knee rocks. Have your arms just out to the side, feet flat on the mat. And I'm going to get Liz to roll her knees to the right, feeling a stretch through the lower part of her lower back, keeping the shoulders really relaxed and heavy. And then slowly as she exhales, pull the knees back in. Does that feel okay, Liz? Mm-hmm. And then going to the other side, keeping those upper shoulders relaxed and getting as much of a stretch as possible. Good. And if you want to pause when you get to one side, if that feels good for you, stay there and breathe and just try and really let that back relax into the stretch. And pause. So that's called knee bends or spine twist. The next exercise is going to help to get some more mobility into flexion of the lower back. So straightening out your legs, Liz. And I'm going to get you to bend your left knee and pull it in towards your chest, feeling a stretch potentially in the lower back and maybe in the front of the hip. So pulling that knee in, and you can repeat the movement by pulling and then releasing, pulling and then releasing, or you can hold. Neither is right or wrong. What you can do also here is you can hold the knee, and you can take this hand away, Liz, and you're going to pull this knee out to the side to stretch the groin a little bit if that feels good for you. Yep. And then you can change hands and pull the knee across and get a little bit of a stretch into your glutes, which we know is a very big contributing factor to lower back pain, tightness there. And then we can come back to the center. So that's a single knee flexion. You can also do a double knee flexion, so bring both knees in and just give your knees a lovely cuddle. If that feels good and you want to make it more intense, you can lift the upper part of the body up and really give them a nice cuddle. Once again, you can hold the stretch, or you can pull the knees in and out and do what we call a repeated movement. Lovely. Now the next exercise is called a hamstring stretch. So hamstrings are a big muscle down the back of the leg and attach into your pelvis and can also be very tight and contribute to lower back pain. So straightening out your right leg, Liz, you're going to lift your left leg up. You can use a towel or a TheraBand or just your hands to hold on to the back of the thigh or the calf. So with this stretch, you want to make sure that the leg stays as straight as possible for you. So if you're not as flexible as Liz and your leg is, somewhere down here, you'll need to be using a towel or a TheraBand. So with stretches, you need to hold them for at least 60 to 90 seconds and repeat it 3 times before you finish the exercise. Does that feel okay, Liz? Mm-hmm. Lovely. That's your hamstring stretch. As I mentioned before, getting into the glutes and keeping them nice and flexible, you can use a spiky or massage ball. We have a video with the spiky balls, all the exercises, so refer to that video for how to release the muscles of your glutes. I'm now going to get you onto your front, Liz, for what we call swan or back extension. With the nature of our lives and a lot of sitting, we tend to get very stiff and we lose extension of our spine. So our back will really appreciate this when we get some extension back into it. So with your legs a little bit wider and toes are pointing inwards, relax through her bottom. Pressing down through your hands, Liz, your gaze will slowly lift up and look towards the kind of wall in front of you, getting a lovely extension through her spine. Does that feel okay? Mm-hmm. And then slowly down. It might start stiff and uncomfortable, but as you do more and we get some lubrication through the joints, it should improve. With this one, you need to do about 10 or more. If it feels great, go and do some more, please. Up and down. You can do these exercises at least 3 times a day or more. And then down. You can sit up, Liz. So those are some exercises to help the mobility of the spine in rotation and flexion and extension. But also we need to make sure that we strengthen the lower part of the back, particularly if you've had back pain, because those muscles have been shown to weaken. So one of our videos known as core activation and basic core exercises can be looked at, and those will give you the basic core exercises that you need to do if you have lower back pain. Thank you very much.